Hi everyone, my name is Donna Kelly-Williams. I'm a registered nurse and I am the co-chair of the Committee to Ensure Safe Patient Care, and I am also the president of the Massachusetts Nurses Association. I am here today to speak as a nurse in support of question 1. I am also here to shed light on the true opponents of this question, hospital executives. The truth is that hospital executives are the reason that we need safe patient limits in the first place. As a registered nurse for over 40 years, I know it has been the hospital executives making it more difficult for nurses to care for our patients. Hospital executives are the ones who have turned a blind eye to patient safety problems. Hospital executives are the ones who have ignored nurses' concerns, claiming a lack of resources for safe patient care while pocketing 7-figure salaries. Hospital executives are the ones who say no on question 1 while hospital profits pile up. Yet hospital executives also know the public does not approve of their actions. The hospitals are making enormous profits from public money, from Medicare, from Medicaid, from state tax dollars, and from your health insurance premiums. If you really want to see who is behind the opposition, it's the executives of the large healthcare systems like the one right behind me, Partners Healthcare. 2 years ago, their executives built this $465 million corporate headquarters in which no patients receive care. In 2017, Partners made $659 million in profits, and yet they oppose a ballot that would ensure that every patient gets the care that they need. We see much of the same from the rest of the hospital industry in Massachusetts. Hospital executives claim they can't afford to provide safe patient care when their hospital systems are posting millions of dollars in profits every year, when they are spending billions to purchase out-of-state hospitals and expand internationally with hospitals in China, Dubai, and Malta, and when they have more than $900 million in the Cayman Islands and other offshore tax havens. This is why hospital executives refuse to be the face of their own campaign. So instead of being transparent, hospital executives are spending millions of dollars to run a campaign solely designed to confuse voters. They are running deceptive ads, putting nursing executives in scrubs and putting them before the camera. This couldn't be further from the truth. The truth is that question 1 and safe patient limits were written by nurses for our patients. Earlier this year, a survey of nurses randomly selected from the Board of Registration in Nursing's list of more than 100,000 registered nurses in Massachusetts found that 86% of nurses say yes to safe patient limits. For years, nurses have rang the alarm about patient care conditions. 90% of nurses reported in that same survey that under current conditions, we cannot provide the care that patients need. If you really want to know who supports yes on question 1, it's us, the nurses at your bedside. We are the nurses and working people who support safe patient limits. The experience of nurses and the scientific evidence is undeniable. We know safe limits mean quality patient care. Don't let a hospital executive tell you otherwise. Thank you.
Take a couple questions.
When you talk about benefits to the patient, what's your benefit?
Having a safe limit to the number of patients that we have at one time actually allows me to get to you quicker. If you put the call light on because you're either having trouble breathing or you need medication, or if you need something as simple as assistance to go to the bathroom. If I have too many patients, all of that care is delayed, and it's the patient that suffers as a result of that.
What happened if voters say no?
I have great confidence in voters voting yes on this because they too want their loved ones to be cared for in the safest way we can do it.
What would customers say?
So given the fact that we have been trying to set limits for the past 20 years and are here today because conditions continue to deteriorate, I can assure you that it will only get worse.
You talked about hospital profits. What about some of the smaller community hospitals that aren't posting the type of profits that a Partners is, but are actually struggling to make it? How will they deal with the ratios?
Hospitals right now are making choices of where they're going to invest their money, and whether it is in staffing and ensuring that their patients are cared for safely, or if they have decided to invest in buying other hospitals in other states or even in other countries. So it is a choice that is made by hospitals where they put their finances.
Any other questions?
We're talking about kind of these hospital executives hiding their support for the question. What are you basing that on?
Everything that we're seeing. As you can see behind me, these are nurses that are on the other side of that call light when you're a patient in the hospital, and when you put that call light on, the nurses that are supporting this question, other nurses that are on the other side of that call light to help you to breathe and to help you to ensure a safe recovery.